The topic will be insomnia. What is insomnia? It is a problem with sleep. People with insomnia have trouble falling asleep or staying asleep, or they do not feel rested when they wake up. It is not about the total number of hours you sleep. Everyone needs a different amount of sleep. Short-term insomnia is when a person has trouble sleeping for a few days or a few weeks. It is usually related to temporary stress and often gets better on its own. Long-term or chronic insomnia is when sleep problems last 3 months or more. Symptoms of insomnia include have trouble falling asleep or staying asleep, feel tired during the day, forget things, or have trouble thinking clearly, get cranky, anxious, irritable, or depressed, have less energy or interest in doing things, make mistakes or get into accidents, and worry about their lack of sleep. The symptoms can be bad and they can affect a person's relationship or work life. They can happen even in people who seem to be sleeping enough hours. Not everyone needs a test. You may need to keep a daily log for a few weeks to track your sleep each night. When did you sleep? How well did you sleep? How many times you woke up? It is important to also understand exercise habits, drinking habits, eating habits, any medications the person may take, use of alcohol or caffeine. Some people may need additional testing, polysomnography, or actigraphy. Insomnia can be treated. If insomnia is related to stress, pain, or a medical problem, treating the problem can help the person sleep better. If the person has chronic insomnia lasting longer than 3 months, there are specific treatments that could help. Cognitive behavioral therapy, or CBT. It is working with someone to understand insomnia, learning ways to build better sleep habits, changing negative thinking patterns that can make insomnia worse. Also, relaxation exercises. Part of CBT involves learning about sleep hygiene. Good sleep hygiene means that the person sleep only good enough to feel rested and then get out of bed, go to bed and get up at the same time every day. Do not try to force yourself to sleep. If you can't sleep, get out of bed and try again later. Have coffee, tea, and other foods with caffeine only in the morning. Avoid alcohol in the late afternoon, evening, and bedtime. Avoid smoking, especially in the evening. Keep your bedroom dark, cool, quiet, and free of reminders of work or other things that cause you stress. Solve problems before you go to bed. Get physical activity, but avoid heavy exercise right before bed. Avoid looking at phones, computer screens, reading devices that give off light before bed. These can make it harder to fall asleep. There are medications that can help with sleep. It is important to discuss with the provider the potential medicines, the side effects, the potential interactions. If the problem is related to depression or anxiety, medications to treat those conditions may help to fall asleep. Alcohol should not be used as a sleeping aid. Relaxation techniques include diaphragmatic breathing, deep breaths, mindfulness. This involves trying to be present in the moment and aware of your physical sensations, thoughts, and emotions. A lot of people find this relaxing and helpful for sleep. Progressive muscle relaxation. Progressively relaxing your muscles from your head down to your feet. Medications options will depend on your age, any other medical problems, insomnia symptoms, whether the person is having trouble falling asleep versus having trouble staying asleep. The main categories include melatonin receptor agonists, histamine receptor antagonists, dual orexin receptor antagonists or DORA, and benzodiazepine receptor agonists. Benzodiazepines examples may include temazepam, triazolam, flurazepam, clozapam. Non-benzodiazepines may have less side effects than benzodiazepines because they work more on sleep centers and less on other areas of the brain. They tend to be short-acting and less likely to make the person feel sleepy in the morning. Some examples include zaleplon, ezoplicone, zolpidem, DORA. Examples include suvorexant, daridorexant. Histamine receptor antagonists include doxepin. Melatonin receptor agonists include ramelteon. This particular medicine works better for people who have difficulty falling asleep. Over-the-counter sleeping aids include antihistamines such as diphenhydramine, melatonin. Over-the-counter medications are generally not recommended for chronic insomnia. Alcohol often interferes with sleep at night. When people stop drinking, they usually sleep better. I hope this information was helpful. Always discuss with your provider your symptoms and potential treatment options. Please join, like, and share my social media for more health education topics. Thank you.